Awesome. Welcome everybody to the From Data to Practice series. This webinar series offers an opportunity to learn how Alaska's Youth Risk Behavior Survey, the YRBS, results are used to inform programs, policies, and priorities across Alaska. Each webinar focuses on a 2019 YRBS topic and results, information on any programs, projects, and resources available across Alaska, and followed by a spotlight on services and outreach efforts in our local communities. Today's webinar will focus on YRBS results related to substance misuse and prevention, with the focus on marijuana use and shared risk and protective factors. Our presenters today will share how YRBS data was used to design and implement a comprehensive plan to address cannabis use in the context of legalization here in the state. So without further ado, a quick introductions of our presenters. First, we have Andrea Fenaughty. She has a PhD in social psychology and spent a decade at the University of Alaska Anchorage conducting research on HIV risk behavior before becoming an epidemiologist with the Alaska Division of Public Health in 2002. She currently serves dual roles as a senior chronic disease epidemiologist and deputy chief for the section of chronic disease prevention and health promotion. Andrea sees surveillance and evaluation as powerful tools that can be used to improve public health programs and ultimately the quality of life for Alaskans. And we also have with us today Eliza Muse. She has worked for the Alaska Department of Health and Social Services since 2011. Her first professional public health experience was working with the Alaska Tobacco and Prevention Control Program on tobacco policy and prevention efforts. Post-marijuana legalization, Eliza joined a team to focus on marijuana policy and education efforts. During this time, Eliza designed and is currently implementing Alaska's marijuana education program, which is funded through state marijuana excise taxes. The program uses evidence-based strategies to develop public health interventions and to minimize marijuana-related adverse health consequences in Alaska. So without further ado, I will turn it over to Andrea and Eliza.
Good afternoon. I'm going to kick us off, and then we're going to do a little tag team with Eliza and myself. I'm Andrea Fenaughty, and thank you, Anna, for that introduction. I am the Deputy Chief over Chronic Disease Prevention and Health Promotion, which is the unit in the Division of Public Health that houses the Youth Risk Behavior Survey, or YRBS. We are still currently recruiting for a new YRBS coordinator, which gives me the opportunity to step in and talk a bit about the YRBS and ways that the data might be useful to folks such as yourself who are working to improve the health of adolescents in Alaska. And I just want to thank the Alaska Children's Trust for hosting this webinar series, and thank all of you for taking time out of your very busy days to join us. And with that said, here's a brief overview. Eliza and I will, as I said, be going a little bit back and forth over the topic areas. I assume most of you are familiar with the YRBS, but I'll take the opportunity to cover the highlights of it, including specific YRBS questions that are related to substance misuse. Then Eliza will be setting the context for why we should care about this topic, and more specifically, introduce the programs that she manages here in Alaska. Then back to me to touch on how you can access YRBS data and what kinds of questions you can ask and answer with YRBS data. And then Eliza and I will alternate discussing select YRBS findings related to substance misuse and possible programmatic implications of those findings. And we should have time at the end to answer any questions that you have. So the YRBS is conducted within randomly sampled high schools across the state. It is carried out by our health department staff working with school staff to administer the survey in partnership with the Department of Education here in Alaska. We do a YRBS in traditional high schools and have a separate sample of what the Department of Education calls alternative schools, or schools that serve students who benefit from non-traditional school settings and programs. Alaska did its first YRBS in 1995 and has been successful in attaining weighted data every odd year since 2007, of course, with the notable exception of 2021. The YRBS survey has over 100 questions covering topics that are associated with the leading causes of significant health outcomes for youth, including safety, violence, suicide, and mental health, alcohol and other drug use, which is what we're going to focus on today, weight status, physical activity and nutrition, tobacco use, connectedness, and sexual health. So just a couple of points on methods. In Alaska, we do only a high school YRBS, so 9th through 12th grade. The schools and classrooms are sampled and then weighted in a way that allows us to end up with data that are representative of high school students across the state. So what that means is we can talk about the percent of Alaska high school students who use e-cigarettes, for example, rather than just saying the percent of students who responded to the survey who use e-cigarettes. Students complete the survey within a single class period. The YRBS is usually conducted in the spring of odd years. We were going to attempt to move it to the fall of 2021 because we were unable to, with the pandemic, accomplish it in the spring. And due to all the additional burdens on schools, we ended up needing to cancel. We had very low school participation this year, but we are focusing our efforts on the 2023 survey, which really is right around the corner. So we can't know all the ways our partners use the YRBS data, but here are some of the most common uses that we hear about. Many programs use YRBS data to track important health outcomes in the state. Programs in and out of state government use the data to improve their programs. For example, our tobacco prevention and control program looks at e-cigarette use among different groups of students to figure out how to better reach students at highest risk. Those conducting community health assessments use the data to help guide the health priorities they will take on. One example of this is Healthy Alaskans 2030. And a number of partners include YRBS data in their grant proposals so that potential funders understand the scope of a given problem and our ability to monitor it. And now I believe we're going to do the scary thing and attempt to actually show a video. So I am going to stop sharing so Anna can take over. Right.
Would you like to know more about Alaska teens? Like whether we're using e-cigarettes, marijuana, and other drugs? Whether we're bullied at school, in our communities, and online? And how we feel about ourselves and our relationships with others? The good news is we can know the answers to these questions. These answers come from Alaska high school students who complete the Youth Risk Behavior Survey, also called the YRBS. The Alaska Department of Health and Social Services runs the survey every 2 years, and it has been offered throughout Alaska and the country for decades. The YRBS includes questions on health and social behaviors. Alaska teens like me share information about tobacco, alcohol, and drug use, physical activity and nutrition, injuries, violence, and bullying, depression and suicide, sexual behaviors, and how connected we feel with others. High school students fill out the survey in the classroom. All participation is voluntary and anonymous, and parents must give their permission before we complete the survey. The Alaska Department of Health and Social Services collects all of the responses from the surveys, and then they analyze them. That gives a picture of health and social behaviors across the state. Sometimes it allows school districts to look at results just for teens in their districts.
For Center for Safe Alaskans, the Youth Risk Behavior Survey is that snapshot of young people from their own mouths telling us how they're doing. And we're able to use that information to support them and address problems in the community so that we can have better outcomes for young people in the long term.
The YRBS is important because we want to have a true understanding of our youth before we try to address the issues in our community. It's hard to address something as important as substance abuse or depression if we really don't know what's going on.
The Anchorage School District uses not only our local data, but state and national data to have structured conversations in our health lessons, and also to take a look at how our teens are doing compared nationwide, statewide.
A lot of kids have false assumptions about what other kids are doing. Like if there's 20 students and one couple is dating, all the other kids feel like everybody has a boyfriend or girlfriend but them, and it's not true. Or if there's a group of 20 kids and 2 or 3 kids in the group drink alcohol. The kids who don't drink feel like everybody's drinking but them. This is just the kind of the way the teenage mind often works. And when they see the data, sometimes it's like, oh, not everybody's doing risky behaviors. Not everybody's doing that. And they maybe feel a little bit better about the decisions they're making.
Traditionally, our campaigns have really been specific to smoking among youth. And so recently we've looked at some of the data around electronic cigarette use, and we've had to course correct in a way to target more of our messaging around electronic cigarettes. And we used the YRBS data to keep track of electronic cigarette use among our youth, to really change the messaging to be more specific to what we're seeing in the data.
We learned about this program in Iceland, which has decreased the substance use of 10th graders. We adapted that program, brought it to Matsu. It has a lot of different components, but some of the main ones are after school and summer programming available to all youth, and specially trained workers and coaches and teachers that are involved with that. And so YRBS was perfect to try and write a grant to fund this, because it collected all the data we needed. It collected the data on how our youth were doing as far as being connected to others in the community, getting the support they needed, and whether they were using substances or not.
At Providence, we have a family medicine clinic that provides whole person care. We have behavioral health care integrated into the medical model. And when we're providing that care, we have used YRBS data to be able to understand the needs of youth and how we can screen effectively. The information that we get from YRBS helps to guide Recover Alaska's programs and initiatives kind of across the board. Everything we do from advocacy and policy to prevention and education to facilitation of other organizations getting together to try to find gaps.
The YRBS is an important way for our voices to be heard. But in order to get the high quality results that many organizations rely on, the YRBS needs your support. Multiple organizations and individuals are crucial to the success of the survey. School districts and schools participate in the YRBS. Teachers, help your students understand the importance of the survey. And parents, complete the permission form for your student. Recover Alaska is so grateful to have the YRBS as one piece of this really rich data landscape that we have, because it would be a huge lift for my organization to have to get all of that data ourselves. But as it is, we can use it to guide our work, and not just Recovers, but the entire community can use it.
I'll pass it back off to you.
All right. So what, I just want to make sure you're looking at the presentation again. Does that look right?
Yes.
Thanks. All right. You beat the odds, Anna, on getting that to work. Thank you. All right. So now I'm going to touch on the questions of interest that are on the YRBS related to substance misuse. So these are sort of the buckets of questions around marijuana use, norms or perceptions, and protective factors. And I'm going to break this down in a little bit more detail. So YRBS marijuana use questions, we've got ever used in a lifetime, current use, our current definition is at least once in the last 30 days. And then we've got usually smoke among users, the way that they use it, the form that they use it in, smoke versus anything else, and then use marijuana before age 13. As far as marijuana related norms and perceptions, we ask, would your friends think it's wrong to use marijuana? What would their parents feel about that? And do they themselves think there's great risk of harm from using marijuana? And we get pretty specific, 1 to 2 times a week. And then there's also the protective factors questions. So here we've sort of broken them into the external and internal supports. For external, do they have parents who talk about how their school day is going every single week? Do they feel like teachers really care about them? Do they participate in after-school activities? Are they comfortable for seeking help from 3 or more adults who are not their parents? And then do they feel like they matter in their own community? The internal ones, and these are more recently added questions. Do they feel they're generally able to control their emotions? And are they able to remain calm when things go wrong? And then do they not feel alone in their life? I'm gonna, at this point, pass it over to Eliza.
Great, thanks, Andrea. Thanks for being here today. Again, my name is Eliza Muse and I manage our marijuana education program, which has a youth prevention component. Andrea listed off some of the types of protective factors that we can capture in the Youth Risk Behavior Survey. So what are these risk and protective factors? They present themselves at various levels in an individual's life. So from sort of this internal or individual level to an external or environmental or community or societal level. So for example, a risk factor at the individual level might be ability to control or regulate our emotions. An environmental risk factor might be experiencing poverty. These factors are oftentimes interrelated. They're cumulative, so they add upon each other, they're additive. Having 3 or more, or sometimes 1 or more, when these risk factors are present in a person's life, may lead to poorer health outcomes or associated with poorer health outcomes. Protective factors similarly have an additive, cumulative, and are interrelated in a person's life and span between an individual asset to an environmental or external factor. So an individual factor might be a positive peer relationship, or an environmental condition might be feeling engaged or connected with your community. And again, these are the same factors that we can take a look at in the YRBS to assess and see how they might impact, for example, substance misuse or marijuana use. I do want to make a note here that not having a risk factor in a youth's life does not automatically or directly mean that a protective factor is present. So there's not this sort of relationship between the two that if one is absent, then that must mean that the opposite of that, is present, that it is a protective factor. So the absence of poverty does not mean that an individual being rich or wealthy or living in a, having that, the opposite of that is not necessarily protective. So I do want to make that note. So the next slide. So this is based off of really extensive research from Becky, Judd, and I'm happy to share the research that she's done here in Alaska that's taken a look at very extensive literature review as to which protective factors are associated with substance misuse and marijuana use. And, I think I've listed many of these factors here that again range from that individual to environmental or community level. So for example, unhealthy community laws related to alcohol and drug use are associated with substance misuse. So community laws similar to tobacco and alcohol taxes, liquor, marijuana licenses, so the increased ability for a community to obtain these marijuana licenses or liquor licenses in proximity to schools and neighborhoods do impact and are associated with an increase in substance misuse. In the same way that it has been extensively researched that strong connection to cultural identity is associated with decreased substance use as well. And so the next slide just shows that as we talk about this today and throughout this conversation, youth are the center of this framework. And we recognize that youth really, or any individual, are influenced by these internal and external factors that occur at various levels in our society. And these factors are cumulative. And they work to shape the people we are today and the negative and healthy behaviors that we might embrace.
So at this point, just back to me to kind of walk through how we can access YRBS data currently. The best way for you to get it is to use the data dashboards that data manager Taslina Mannix created last year. They're easy to use and provide pretty quick access to the majority of what data users request. I'll go through a few screenshots that show how to access them, and then maybe we can put links in the chat to show how to access them. So starting off here, the main, if you just Googled YRBS data dashboards, it would take you to this page, and you need to click on the data dashboard box to get to actually where the data are. So that would get you here. So you'll land here, and the first thing that you would do is select the health topic, sort of that broader grouping of health things that you might be interested in. So that's right here, this little drop down, and you would see this list of health topics. So let's say I'm interested in nutrition, body weight. I click on that, and then that limits the indicators within that. And you can see down below, I can look at sugary drink consumption. I can look at healthy weight. Maybe I'm interested in the percentage of adolescents who are obese. I would click on obese, and that would take me to the dashboard for that specific indicator. So you'll see prevalence estimates and confidence intervals, which is sort of, you know, like the plus or minus error, margin of error around each one, for the most recent year of data here, 2019. And you'll see it's overall, it's by sex, by age, by grade level, and by race. And then you can change the year. So by default, it will bring you to the most current year, but you could change the year by clicking that little year button and get to previous years if you want. Farther down on the page, you'll see trends over the time period for which the measure was on the YRBS. So here we're looking at for overall and by sex and by race, race is below this one, what that trend, in this case, obesity, looks like. And note, you can see if what is called the linear trend, so if you're like a straight line through all those points, is it really different from zero? And that's what the linear trend is. And so that you can see for long term, it's saying this increased. And then the short term trend is just since the previous time period, in this case from 2017 to 2019, it said that that was not a significant change. So before I launch into review of what some of the YRBS substance misuse data show, I wanted to frame this presentation in terms of questions that data can be used to answer, and specifically what programmatic questions might look like, just to get you thinking about the different ways you can use YRBS data. First, the overall percentages are prevalence estimates. That's what we call them. That is, they tell how common or prevalent a specific behavior is. There are many uses of this kind of information, but one is that it can shine a light on area where intervention is really needed. If we see some particular risk behavior or condition that is very common, such as overweight, it might tell us we need to do something about that. Trends in a prevalence estimate tell us if a behavior is increasing or decreasing. So similar to the previous example, they can alert us to areas of growing concern, such as e-cigarette use. But they can also be used to get a sense of whether a program or policy is having its intended effect, or if we need to try a different approach. I'll make the caveat that the YRBS is a point in time survey, right? We're not surveying the same kids over time. So we can't really use YRBS data by themselves to show cause and effect. We can, however, look at trends over time and see if they're consistent with what we would expect to have happen as a result of policies or programs that we put in place over time. And finally, comparing subgroups of students can be really useful as we design programs, knowing who might be at most need of a program, or finding those groups that are positive deviants, right? Maybe there's something we can learn about why one subgroup of teens seems to be at less risk than others. With those questions outlined, I'm going to share some of the data we see with the marijuana use and related YRBS measures I showed earlier. And then after each set, I'll invite Eliza to offer any actual or potential uses of the data for her program or partner she works with. So first here, this is the percentage of high school students who report ever, is the blue line, having used marijuana and currently use marijuana, which is the green line. So what you can see is that ever line is on the decline, and that the little yellow asterisk tells you that that's significant between 2007 and 2019. Current use, however, has remained at about 1 in 5 students consistent over that entire 12-year period. So the long-term trend that is provided on the data dashboard, again, I referred to this earlier, it's called a linear trend. So it tests that best fitting straight line to see if it differs enough from horizontal to be considered statistically significant over time. So this dashed yellow line tells you that in fact was significant for ever use, but not for current use. I'm turning it to Eliza.
So in 2017, the Department of Health and Social Services was asked and tasked to design a comprehensive marijuana education program. There was going to be a new revenue stream from marijuana taxes that came to the department through to the Division of Public Health to address marijuana use in the context of legalization. For the youth prevention component, we looked at these data that we had available to us from YRBS and also that formative research from Becky, Judd, and realized that we can be efficient with these resources and use these funds in a way that might actually serve multiple purposes. We know that quality after-school programs serve as that protective factor to reduce youth substance misuse. We also knew that after-school had been underfunded here in Alaska, and participation rates were dropping off once kids had started middle school. And that looking at that initiation data, which Andrea said is available to us in YRBS, that about 1 in 10 Alaska kids had tried cannabis before the age of 13. So taking all these data together, we worked with the Alaska After School Network to allocate funding to programs statewide to quality after school programs. We're now in year 3 of this first cohort, and I'm really excited to about all the work that's happening across the state. So the next slide just kind of shares back that extensive literature review of Becky, Judd, and then, sorry, if you just maybe advance one more. So a prioritization process obviously had to occur here. There's a variety of risk factors and protective factors listed here, but looking at the YRBS data, and then the data shared to us from our partners around participation after school programs, we made the decision to specifically and explicitly fund out of school time. And I think we've really got good data to support that. And then if we go into the next slide, went through a logic model process of what this would look like and how we're going to measure it. And so again, our focus today is on the investment in after school programs. And then as we kind of work our way through these slides, so if we click the next slide, yeah. So the short-term outcomes that we're measuring through YRBS are around risk of harm, youth and peer knowledge around those beliefs, disapproval from parents or adults and peers of marijuana use measured through YRBS, and then on to the long-term outcomes specifically for YRBS. Community, so connections to 3 or more adults other than parents, mattering in their community, those emotional management and self-regulation skills, also the early initiation, so before the age of 13 of marijuana use, current use, so past 30-day use, as well as heavy use.
So moving on to another variable we could look at in the data dashboard, this is how they're using marijuana. And so this is among those who say they use, or how many are smoking. And it looks like smoking as a mode of use, so not overall use of marijuana, but the percentage of those who smoke it primarily is on the decline. You can see the blue line is girls, the green line is boys. And so there's been consistently a little bit of a difference there where girls are more likely to smoke it if they're using it, but that both lines are going down over time.
So with that and with these data, what does that also mean? So if we think back about the current use staying flat, and then these data around smoking, what are we seeing anything that might be increasing? So, or with this stable use, are there certain populations that among all of those surveyed, is their use going down, but there might be certain populations that are keeping, in other words, Andrew, you probably say this better than me, but that are not allowing the overall trend line to go down because certain populations may be keeping us at stable. So while in certain populations use might be going down, is there another demographic or population that is using at greater rates that overall we've got a prevalence that is stable? And so that's where it's very unique in that we can get in and start to stratify by different demographics to get that full picture of how youth are using and who is using, and then be able to again tailor those programmatic elements to be very specific and explicit to certain perhaps demographics to target those prevention efforts.
And that leads right into this slide, which is sort of a demographic profile on one question, which is one way to use the data. And I'll say, as a caveat, we're limited in the YRBS. There's not, we don't have a whole lot of demographic data. I mean, we know sex and age and grade and race, and that's kind of it. But it is useful to look at those. And so this is showing for the percentage of students currently using marijuana, showing where those differences are by those groups. And they have the confidence intervals on there so you can see. I mean, if you've got confidence intervals that are not overlapping, those groups are statistically significantly different from each other. And you can see some differences by these different demographic measures. Another thing we can do is look at sort of a set of measures over time and compare what's going on with that set. So this is not over a long period of time. This is just between 2017 and 2019. But we see when we look at those sort of perceptions, norms questions, more students think that their parents feel there is great harm in marijuana use. So you can see a little bit of an increase there from 2017 to 2019. And compared to the percent that say their friends feel it's wrong or they themselves see great risk of harm. That may not be rocket science to those of you on this call, but to see all that data together can be useful to see what's going on in terms of the norms among high school students. And Eliza previously highlighted the fact that because of their connection to substance use, they identified a long-term outcome of increasing protective factors in the recent logic model. One of those factors is related to emotional self-regulation. And so we have that data we could look at. And so we know in 2019, about 6 in 10 high school students reported having these internal assets related to self-regulation. So 61% said they are able to stay calm when things go wrong for them, and slightly more, 66%, say they frequently or almost always are able to control their emotions when they need to. And one additional way that it can be useful is like look at a complete longer set of variables just across the whole set of students. So here we see in 2019, students felt some of those external supports more than they felt the others. You can just see kind of at a glance, a lot of the high school students are feeling that their teachers encourage them, less so feel like their parents are talking to them every day about school. So just kind of get a sense of what that experience is for them.
So Andrea, there was a question about the ability to further disaggregate, further disaggregation of the data with regards to race, ethnicity, or versus like urban, rural. And then could you get even further by saying urban, rural, race, ethnicity, and then gender? Can we do that?
Sure.
Not
So,
today, but just in general on the dashboard.
yeah. I mean, there are some limits, I will say, and what the dashboard allows is what is out there. I think we don't have it disaggregated beyond what I shared. But if there's finer grained data that people are interested in, you can email Teslina Mannix at the state, and you could reach her through the YRBS at alaska.gov email address and put in a data request. And some of those things, there may be some disaggregations that are possible and some that aren't. Some may require combining multiple years of data. Because we want to protect the students' confidentiality and also have really solid data. Sometimes our numbers get too small. It's really not good practice to release those data. So some of that might be a limitation, but yeah, there's certainly some options beyond just what I've shown you that could be possible.
Great. And this question did come from a current grantee of our program from the PIDUP, Positive Youth Development After School Program, Joe. And so I know you've asked this question before, and because YRBS right now is very short staffed, we have a external evaluator contracts through a contract support who's also able to help with these kind of novel analyses or just these sort of additional analysis beyond what the dashboard can provide. So I think you probably sent me an email request about this, Joe, and so I will kind of dust that off and try to work with our contractors in the interim, just because I know that YRBS is working to hire so that they can be able to run the survey and do those sort of analysis that program partners are looking for as well. And so we do have a program. So we've got our after school program. We're looking at this map here with all these yellow stars, and we are in year 3 of a funded, really intentional effort to fund these out of school programs and summer programs, which has a really large emphasis on quality and professional development. Erin here is on the call and has been really working, Moriarty from the After School Network, and working to provide technical assistance in professional development and through quality assurance and assessment at each individual site. So we have sort of a whole package of technical assistance that we're providing to our programs in terms of implementing these quality programs, because it's the quality piece that really matters here as well, and the intentionality and the intentional effort here of working in a positive youth development framework for providing these services to youth, which includes having a safe environment and a safe place, but also intentional and frequent activities. And then we have additional resources as part of the after school program kind of service of offerings. There is a very explicit cannabis prevention curriculum that grantees may choose. We do require these grantees to have some sort of outcome-based curriculum that they do use with their youth. But there is one that we provide training around called Healthy Lifestyles. It was developed actually for Colorado and Denver when marijuana was first legalized, to really kind of address and facilitate staff to have these conversations with youth around cannabis now that is legal, and to really try to disrupt some of those myths that we do hear now that cannabis is legal. Oh, is it safer? Is it a safer alternative to X, Y, and Z? It's from the earth, it's from the ground. It's a lot of the same sort of conversations that some youth might have around tobacco, or just questions around tobacco. So that's a curriculum that we do offer. Again, the TA through After School Network. And then earlier on, we had developed a parents guide. So parents, again, through YRBS, we know are trusted messengers, or youth that have 3 or more trusted adults in their life. So this is a parents guide, but also other trusted adults can use this guide to have sort of real one-on-one conversations with youth now that cannabis is legal, really have kind of support the parents, also supporting parents with this teen brain and marijuana fact sheet. So we know that cannabis use, especially regular, progressing maybe to heavy use, can have impacts on the developing adolescent brain. And so this is a fact sheet for adults and staff to use with teens around how use during this crucial brain development period during adolescence can impact those neural pathways in the brain. And so that's sort of the resources we have. And then the next slide just shows, just because Anna had said that it might come up as a question, we presented a poster, and I'll give the full poster in the next slide, but this is just sort of the cliff notes here of increasing sales. So once our marketplace opened up in 2016, we got sales starting in 2017. It just shows this overall growth of the industry in sales, cannabis sales. With a peak, you'll see here, very interestingly, right during a summer month of the pandemic. So July 2020, sales peaking at 25.8. We, yes, it's increasing. There was a paper that we published on kind of looking at from April to December, from 2019 to 2020, and does show a trend line of increasing sales. But this is to be expected of a new industry. But it's very interesting that in the pandemic, we did see this very sharp increase, which sort of different survey. And, we're adding this in here today. It's not the YRBS survey, but the Women's Children Family Health did a survey along the same period during the pandemic months of April through November, and did find that this is the bottom graphs of consuming more, and then emotional health, that adults, so 18 and over, reported during the same period of those reported that their cannabis use did increase, from the start of the pandemic, of a lot of substances, but we've circled marijuana and cannabis use here. Also, that especially for the younger survey respondents, emotional health had gotten worse. So there are also some other things that happened throughout the pandemic, including temporary rule changes for cannabis outlets. They could do drive-throughs and online sales and internet. And so access opened up because they wanted to mitigate COVID-19, so implement a COVID-19 mitigation strategy. So encourage social distancing, which also meant that they could have alternative ways to selling these products. And so just wanted to share that, sales are growing. And so if you go to the next slide, here's our full poster with all of these details. It was we submitted to the Public Health Summit last week. And so sort of the take home is sales are increasing. They definitely peaked during the pandemic. At the same time, Alaskans did report, especially younger Alaskans, worsening emotional health, and that they were consuming more products. What these data don't tell us, though, is the demographic. So the age of who was purchasing. We're assuming these are 21 and over because there are pretty strong ID checks both at the door and at point of sale when you're purchasing a cannabis product. But this kind of goes to tell us that we need to continue to support our YRBS data, our adult use data systems, and then also have other sort of novel approaches to understanding who is using, who might be using more. Are these sales data, are these new users, or are these people that were already using and are just, stockpiling or purchasing more? What types of products are these individually using? Higher potency products, edibles, vapes, smoking products. So this just is sort of the tip of the iceberg. We want to know more, and YRBS is definitely one piece of the full picture of the sort of data landscape that we can use to inform the programs that we fund and the work that you all are doing as well.
All right, I'm going to do a couple of wrapping up points, but just thank you, Eliza, for being so articulate about making the points you just did. And I just want to emphasize I think the YRBS is an amazing surveillance system. It doesn't tell you everything. I mean, Eliza is looking at sales data, YRBS data, other survey data. And, you know, even at that, a lot of the questions that we need answered to put effective programs in place on the ground, the why behind everything, survey isn't going to answer that. So we look at qualitative, we look at individual, we look at focus groups. I mean, I think the whole whatever panoply of tools we have at our disposal, the more we can build off them and use them together, that's really how we end up being successful. So just make that plug. So YRBS and adolescent marijuana use programs, I guess I would just encourage you to use the YRBS as one of the data sources that might be useful to you in the work that you're doing. Try out the dashboards. I mean, I find them easy to use. If you don't, reach out to us. We can help you. We can fix it. We're always trying to do quality improvement and make it so that people don't have to talk to 10 people to get the data, that they can just get it themselves. If you have used YRBS data, we would love to hear how. We get asked about this all the time. You can imagine our funders love to hear about this. So if you can shoot us a note and say, this is what worked, or, you know, I thought I could use it this way and I was not able to, we want to hear that as well. And if you haven't used YRBS data in the past, I encourage you to try to consider ways that the data might be useful for your program. You've seen several different things highlighted by Eliza, how they've been able to use it. But I know that there's lots of other possibilities out there. If you do have questions about YRBS or any specific questions on like how to use the dashboards or anything else around the surveillance system, don't hesitate to shoot Taz an email. That yrbs.alaska.gov will go right to her. And if you have more specific content related questions about the marijuana use programs that Eliza is involved in and risk and protective factors, she's provided her email there as well. So I guess this is the point where we leave it up to you to see if you have any questions for us.
I have a couple questions. How much does the YRBS questions change from year to year? And are the questions the same for every state every year?
That's a great question. So of course, it's complicated. They do change from year to year, some of them. There are some questions that have been asked since the very beginning. And there are some questions as emerging, you know, e-cigarettes used to not be a thing, all of a sudden it's a thing. And that means other questions have to go off because you can't end up with a 5-hour-long survey, right? So we go through a pretty extensive process involving subject matter experts in all the different areas, data experts who know what a good quality question is and what is maybe not going to give you usable data, community partners who can let us know that's fine for the rest of the country, but what matters in Alaska is, you know, these 3 things we have to have. So we try to incorporate all of those things, which is important and challenging, but we try to get the best survey out we can. The start of that is the CDC's questionnaire. So they give us, and they will be giving us the 2023 survey in about June, I think we usually get it. And that's our starting point. We have to use, I think it's like 99 or maybe 89 total questions. We have to use like 60 something of those questions. They don't tell us which 60, but that proportion have to be the same. And that's because like the CDC obviously wants to be able to say something about the whole country. But then that gives us a bit of wiggle room to say, you know, we think this particular question related to whatever, a suicide question or something else that maybe the rest of the country is less interested, we can put that on. So we do have some flexibility. Again, as I say, it's a balancing act of trying to have it be the best thing for most of our partners, right? Everyone's not ever going to be completely happy with one survey, but balancing that with having it be a questionnaire that the student can fill out in one class period.
Andrea, I had a question. So when the question on the YRBS around youth smoking, so does that include vaping? And I guess another question on top of that, are there other questions around other methods of consumption?
For other consumption of tobacco?
Marijuana.
Oh, for marijuana.
Yes.
So there is vaping questions. I should have pulled it up, and I should tell you all that the questionnaires are all available online, so anybody can look at what those questions are. And so we do ask vaping separate from smoking. Eliza, looks like you're going to chime in there.
Yeah, so the report, Joe, thanks, Joe, for posting that report. It's our 2020 update, and it includes 2019 data on it, and includes the one-to-one YRBS questions. So we've got all the mode of use questions there too in those responses. And it also has some additional sort of analyses that we were able to do on our own that you might not be able to access just directly from the dashboard. So I do want to say that is sort of as a qualifier that this report will have sort of additional analyses that we might be able that we can do sort of offline outside of the dashboard. So looking at different specific protective factors and or a shared factor as it pertains specifically to marijuana use. So yeah, and mode of use is in that report.
Andrea, I have a question, or maybe this is an Eliza question. This is Thomas. Thinking of the ways the cannabis industry has changed now with edibles going up in strength and potency. I know for YRBS, we asked questions around like, was it beer or was it hard alcohol? Was it wine? Do you see that kind of nationally, those questions starting to emerge or being asked in other states that have legalized? And if so, kind of like, where do we compare it to like with our YRBS question data and questions we're asking to other legalized states?
That's a really good question in terms of how we compare. I think we've used pretty standard questions that are either the ones that CDC has come out with or in some cases ones we've been using. I'm looking at you, Eliza, I'm thinking Julia Dilly would know how to answer this because we have a research partner who works across multiple states, and she could probably say where we might be the same or different.
So we have a kind of a spreadsheet, but have a spreadsheet of sort of the allowable milligrams per edible, right? And so I would say that our data surveillance systems across the board for adult and youth don't do a great job of capturing this sort of or keeping up with industry practice and what is available to the consumer. So an edible in a marketplace here in Alaska has changed. So it's gone from 5 milligrams to 10 milligrams. Now we've caught up, I guess, for lack of a better term, with Washington, and Oregon is also working to increase their THC for edibles. In Canada, it's 5 milligrams, maybe it's 10 milligrams. But so what the industry is saying is that it's the norm that it's 10 milligrams. We used to be 5. But whether or not our surveillance systems have not necessarily caught up, it's how do you most often consume? Is it edibles or is it smoke? You don't necessarily get into the potency or the concentrate. We have additional surveys that we do here in Alaska that are more novel, that really ask about, the behaviors. So if you say you currently used or once in the past 30 days, what does that actually mean? Is that like an all day bong session, or is that just like a couple of hits off a joint, or is it taking a 5 milligram edibles or having a serving size of an edible? So yeah, all that to say that I would say that nationally the national questions or CDC modules or those questions are baseline and don't necessarily get into the aren't caught up to the reflective of the current marketplace.
And I guess I would just throw out there that a surveillance system might not be the best way to get that. I think there's plenty of people who probably could tell you exactly what they're ingesting and plenty of people who couldn't. So, that might be data best collected another way.
I will say we've asked Alaskans, do they know what they're using and what the milligram size is? And 9 times out of 10, they say no, but it's just right. They don't know what it is, but it's just right. So and we're trying to figure out how is the best way to share those data, but that's again separate from YRBS.
Thanks, Eliza. So I'm aware of the time. We have about a minute left or so. So before we kind of end our time together, I just want to thank you, Andrea and Eliza. Thank you for being here and sharing and helping decipher the data from the YRBS and showing us kind of what's on the horizon in terms of prevention efforts and what's happening in Alaska. If you would all, I'm going to drop in the chat a link just to evaluation. If you just take a moment, it should take about 2 minutes to complete the evaluation for today's training. Your feedback is greatly appreciated. It really helps us shape and guide this training series and makes it as beneficial and to make them as beneficial as we can for you all. So that will be here in the chat as well. If you have any additional questions or want to chat with Eliza or Andrea, we'll stay on for a little bit longer, but it is 1. So thank you all for being here and hope you enjoy the rest of your Thursday.
And sorry guys, the report that doesn't have 2019 data, so it's 2017 up to 2017. So I just attached our latest information, the 2019 data for YRBS. So hopefully folks, before you drop off, you can snag that report and I'll work to get that up on our website as well.
Eliza, too, I'll send up a follow-up email with all the links. I know there are a lot of links and attachments, so I'll follow up at the end.
I also noticed we said it was 2021 today. Oops.
Nobody knows.
Delete slide.
I saw a post today. There's 738 days in January. So
Yeah.
I feel that.